First at 10, health officials here in West Michigan concerned about what a new, more contagious strain of COVID-19 could mean for case numbers, hospitalizations, and deaths in the area. It comes after the state health department identified the first case on the east side of our state this weekend. Fox 17's Marisa Oberly reports.
The new strain is called B.1.1.7. Doctors first discovered it in the United Kingdom, and it's since spread to more than 50 countries and several states in the U.S.
Local health officials on alert after the Michigan Department of Health and Human Services announced Saturday a woman from Washtenaw County is the state's first case of a new strain of COVID-19.
We're watching it. We're certainly not looking forward to it and would love to avoid it.
It's known as B.1.1.7, and Dr. Andrew Jamison with Mercy Health St. Mary says it's possible it may already be in West Michigan. According to the state, the infected woman recently traveled to the United Kingdom, where the variant was first detected in the final months of 2020.
And so what happened here is this, during the replication process, the RNA, as it was going through its dividing, had an error. The error didn't get fixed, but that error actually made it easier for the virus to attach to people.
Jamison says while the symptoms and severity of the new strain do not appear to be any different than the original, this variant spreads more easily. Jamison worries about its impact if it's spread here, saying right now the area's current outbreak is manageable.
If you are getting more people infected than normal, basically that same percentage of people that would be getting sick are still going to get sick. And so if we're looking at, instead of 100 patients in Kent County that get infected one day, all of a sudden up to 300 patients, that same percentage increase will end up coming to the hospital. So we're going to have a lot more people that end up getting hospitalized.
Dr. Liam Sullivan at Spectrum Health urges people to continue good health practices.
They need to keep wearing masks. They need to keep practicing social distancing. They need to keep avoiding crowds for right now, keep washing their hands.
Current tests work against B.1.1.7, but to identify the variant, samples must be sent to the state. Pfizer's vaccine appears to prevent it too. Moderna is still testing.
Pay attention. If we're shutting things down and we're backing off, we need patience and we need help. We're doing it for a reason.
This woman is Michigan's only B.1.1.7 case. In its announcement on Saturday, the state said it did identify 2 other cases through her close contacts, but as of this afternoon, it's not known if they are infected with that variant. I'm reporting in Grand Rapids.